So herpes simplex virus 3, as well known as varicella zoster virus, because it can cause two infections, which nowadays are confirmed to be actually the same infection. It is varicella or chickenpox, and zoster or shingles, common name in community. So similar to herpes simplex infections, humans are the only recognized hosts, and actually in some centuries ago, chickenpox and smallpox was thought to be the same infection. Nowadays they are distinguished, and we have different agents, different types of infection, and chickenpox is the separate disease. So the correct medical name of the disease is varicella infection, and it has very similar appearance with previous two infections. So varicella zoster virus is commonly named as vis-a-vis, and it is again persistent in neural ganglion and remains latent here. So nowadays it is confirmed that actually after primary infection, which is known as chickenpox, virus will remain latent, and in future it can cause exacerbations or recurrent episodes, which are known as herpes zoster. So previously, again, we thought that zoster is a separate type of infection, but nowadays it is confirmed that it is consequence of initial chickenpox. So reactivation of vis-a-vis usually occurs in elder period, in much elder period, usually when people have natural decrease of immune functions with the age. Zoster became active and caused those recurrent infections. So very rarely chickenpox and especially zoster occur in lethal outcomes, but it is known that some about 400,000 deaths are described to be caused by herpes viruses. So rate is really small, but still it is possible to have lethal outcomes. So as for any other infection caused by herpes virus, source of infection is always infected human, or usually disease chickenpox is known as a kid's disease, and initially first episode occurs in kids age up to some first 5 years of life. And of course, in that time period, usually disease is transmitted by air droplets way, by sneezing, coughing, when kids are attending the same collective kindergarten or school or some extra class activities. And in small kids, disease can be transmitted by direct contact through sharing toys, through licking some common stuff. Incubation period usually lasts not more than 3 weeks, and similar manner, virus will enter through respiratory epithelium or some damages of the skin. As well, virus can enter through conjunctiva of eyes. And especially in adults, before, if subject became ill first with chickenpox in adults age, before classic symptomatic, subject will have fever and malaise for a few days before rashes will appear. So after infection, after entry through respiratory epithelium, virus will multiply locally or will pass to regional lymph nodes and multiply here. And after that, it will spread over the body, causing primary viremia, which can last for about a week. From blood, virus will spread to parenchymal organs such as liver and spleen. And as far as it is neurotropic virus, it will go to sensory ganglia as well. And actually, here locally in internal organs, virus will multiply again, and after that, it will leave organs to bloodstream and cause secondary viremia. That episode of secondary viremia will manifest with unique lesions, which actually occurs as macules progress into papules, vesicles. They will be covered with the crossed open, the same ulcers, and after that, they will heal. So, infection is generalized, and of course, the whole body of the kid will be covered with those lesions. One infected person, especially kid, can have up to 500 lesions at the same time over the body, and they can be in different stages of progression. Some will just appear, some will already be close to convalescence, and the most different thing with those lesions, they're very itchy. And usually, besides symptoms of systemic infection, kids suffering from serious itching, they will try to scratch those lesions, and the same problem occurs in elder age. If it is zoster infection, then the same types of lesions will occur over the body, but usually they're observed in in the area of the trunk, and they are observed by the way of the ribs. Usually, neurons or nerves in chest, they are going under the rib, and that area of innervation is repeating position of the ribs. Lesion can be monolateral or bilateral, but it is going from spinal cord to the middle of the chest or to the middle of the abdomen. If it is bilateral lesion, it will go as a ring around the subject. So lesions are the same origin. They have transparent liquid inside, especially if people wearing some tightly clothes. They will be easily broken and release liquid. It is very good seen through clothes. It will occur as a wet spots on the clothes, and of course they will become painful, and that pain sometimes is described again as a shooting pain. So it is causing a lot of discomfort. People cannot perform regular activity because it's difficult to move, it's difficult to sleep, and uh, if it is some visible part of the skin, of course, it will change general appearance, and people usually kind of shiny of that thing. So in both cases, spontaneous convalescence will occur, and subject will remain in latent stage, and virus will go into neural ganglion and establish lifelong patency here. So we don't have any specific therapy of the disease, and the only thing, as we said, is serious and severe itching, and very often, especially young kids, they can scratch the skin so significantly that first bacterial flora can add, and then serious inflammation can occur, some skin infection, so underlying skin tissues can be infected with bacteria, lead to some phlegmon, abscess, and other bacterial complications. So for that purpose, we have usually parents are using some topical antiseptics such as brilliant green, iodine, or magnesium, and of course it's painful to apply spiritual solutions on ulcers. It is difficult for kids. And parents usually trying to play some kind of game. They will draw different figures such as mustards or eye watches, as you can see here, or just cover the whole kid and pretend that it is a crocodile or something like that. And it is the way to prevent bacterial infection. Second thing, if kid will scratch skin so deeply that growth layer of epithelium will be damaged, then even after chickenpox, some scars can remain on the skin, especially if it is skin of the face, near eyes, or some thin parts of the skin. And to prevent that, we have different topical lotions such as calamine lotion to release itching, to prevent scratching and damages of epithelium. So in common way, in classic way, varicella will not leave any scars, any damages, any pigmentation, and after convalescence, skin will be completely intact and remains not damaged. So to prevent disease, nowadays we have already vaccine against varicella, and it is VV vaccine, separate monovalent vaccine, which contains a live virus. And we have combined vaccine, MMRV, measles, mumps, rubella, varicella. It is quadrivalent vaccine, containing 4 live viruses. And recently it was announced that herpes zoster vaccine is registered in some countries. It is again vaccine against not chickenpox. It is only for elderly people against shingles to prevent that infection. Vaccine as well as a live containing attenuated varicella zoster virus. So if you talk about varicella vaccine, separate monovalent vaccine, it is a live vaccine which is indicated for kids in 2 doses. First dose should be given in a year of age, and second 4 to 6 years. So vaccination schedule is the same as for MMR vaccine, and mainly doctors prefer to combine two vaccines together and inject varicella vaccine together with MMR vaccine. So if elder kids require vaccination, especially it is important for girls because chickenpox is more dangerous during pregnancy, and a lot of people asking, can I perform vaccination against varicella virus, varicella disease before pregnancy in adults age? And that vaccine is approved for adults, and 2 doses as well should be provided with the interval about a month, not less than a month. So in some cases, that vaccine is useful for women before pregnancy if a girl was not ill and was not vaccinated at childhood age. So herpes zoster vaccine, again, it is a vaccine approved for elder people, and that vaccine is approved only in few countries. In some countries, indication is age above 50 years of, and in some countries it is age of 60 years and more. So vaccine is given for people who want to prevent shingles episodes, and in our country that vaccine is not approved. In your country as well, that vaccine is not approved here. And that vaccine, MMR vaccine, which is actually replaced already classic MMR vaccine in number of countries. It is quadrivalent vaccine, which is available in different manufacturers. And usually schedule of vaccination is the same as for MMR vaccine. 2 doses in 1 year of age and in 4 to 6 year of age. 2 doses of vaccine is enough to cover diseases and to prevent infection by varicella virus as well.